As the Code of Ethics states in E5C, there are social and historical prejudices that can be associated with diagnosing due to pathologizing someone. With that said, there can be a great risk associated with diagnoses. There's also the fact that a misdiagnosis can be harmful both emotionally and physically. This is why a counselor needs to be educated on diagnosing so that proper treatment and care can be found. Counselors have a great ethical responsibility to minimize as much harm as possible to a client or patient as possible. This is why it's stated in E5D of the Code of Ethics that a counselor may refrain from making and or reporting a diagnosis if they believe that it would harm a client. Counselors have such a great responsibility to consider the implications of a diagnosis, both positive and negative. With all of this responsibility, it brings me a lot of mixed feelings. On one hand, I know it can be stigmatizing and alienating to diagnose, and I don't know if it is in all situations needed. But on the other hand, it's sometimes critical. When I think of someone with severe symptoms, um, that could be life-threatening, it is important to find the correct diagnosis. They might live with stigma and or biases from others, but without knowing what is the core underlying present issue, um, they may not have a chance of recovery or living anything close to the life that they really want to live. I think that regardless of a proper diagnosis being found, some people may still live a life where they are judged by others due to someone not understanding them or the symptoms they endure. That can make the person with those symptoms feel disadvantaged. With that said, if a diagnosis is paramount to recovery or living a fuller life, then a correct diagnosis is vital. Overall, something going undiagnosed could end up being more harmful because the proper treatment was not found or done. A misdiagnosis may result in improper treatment and or medication used. Even with a correct diagnosis, treatment or medication can go wrong. So with all of this said, it reinforces to me just how vital learning about diagnosing is and how paramount it is to our education. I personally am passionate about being in network with insurance, um, and being able to be in network with insurance companies so that people can use their insurance benefits for counseling if they wish to. A significant and required component for submitting a sessions invoice to insurance is identifying a diagnosis. I've seen that invoices always require a diagnosis and a CPT code that corresponds to session type and length of session for the counseling that is done. At my place of work, counselors and other providers like psychiatrists and psychiatric mental health nurse practitioners have to select from a drop-down list a diagnosis in which all diagnoses in the DSM-5 are listed. I do know after asking some clinicians that they will sometimes use a diagnosis called adjustment disorder unspecified, F43.20, which is used when a diagnosis is still unclear or sometimes to avoid picking an actual diagnosis overall. However, this can only be used so many times before an invoice may be denied or additional documentation is requested by the insurance. Uh, I know that some providers who do not take insurance simply because they do not want to deal with diagnosing at all. Um, even with this said, I think I'm always going to accept some insurances if I can. They're making it easier today with certain companies. You don't have to get a network by yourself. And so I think, you know, for me to be able to get a reimbursement rate from insurance, so that a client just has a copay versus a complete session that they'd have to pay for out of pocket. It really is so essential that can be done. Um, and so that's what I plan to do. Um, but overall, I think there are a lot of factors to consider, and counselors are always going to have to understand how sensitive and how important of a matter diagnosing someone is. Thank you. Good night, everybody. Oops.